So all these deep learning, this machine learning, whatever comes in with us, it helps us to pick up those red flags that we call, something which can pick up very early to find out if in future this particular person has come to me, say for health checkup, and we have picked up, for example, visceral adiposity. Now, for the patient, it's something which is very common because for him it is a typical Indian subset that he belongs to, and for him visceral adiposity is no big deal, as Naman was saying, is correct. But we know now that this adiposity is going to cause metabolic problems in future, and that will ultimately lead to cardiac issues. What this particular program does in addition to it is, it helps us, it suggests us if we can do something more, right? If you missed out, say, particular investigations such as CRP or a lipoprotein little A, or something which can further risk stratify the patient into a high risk or intermediate risk. Sunil used to very famously say that Indians are all high risk. There's nobody at low risk at all. So you're either at mildly high risk or at very high risk. So we traditionally, genetically, phenotypically, we belong to a very high risk population. Now, among that high risk, how high your risk is, if we can pick up that very early, probably we can stop it from becoming a health checkup person into a cardiac patient. As we have done in the pilot study, we've been able to pick up a lot of red flags very early, and that has really helped us to identify people. I also suggest, it will suggest you some investigations, suggest some recommendations for lifestyle as well as medications which you may or may not feel necessary, but at least the recommendations, the suggestion is there. So I think it is a very important step, and I personally feel that it has a long way to go.